Thank you very much, Mr. Chairman. It's a pleasure to be with you as always. And so, Dr. Ramoni, I'd like to focus on the VA's National Artificial Intelligence Institute. There's no reason that the VA shouldn't be the world leader in adopting AI into healthcare practices. If implemented properly, it could be revolutionary, easing our staffing issues, monitoring our patients' safety, predicting diseases, mental illness, all the things that go with that, creating novel treatments, and thousands of other applications we know. So how is the work at the VA's AI Institute being prioritized by the VA? How far along are you?
Yes, so thank you, Senator. We started up the National AI Institute a few years ago, not knowing that the generative AI revolution was just around the corner, but we are fortunate to have as our leader of that AI Institute, Gil Alturovitz, and a team of people around the country in different medical centers doing that work. Because we were able to lay that foundation, we have been able to participate in a number of national efforts, including the most recent executive order, ensuring that VA is on the map for AI, and to ensure that trustworthy AI principles.
Have you all basically briefed Secretary McDonough and Deputy Secretary Bradshaw?
Have we briefed them? Yes, they certainly are.
They're on top of it.
Yes, they are certainly read into the AI.
Let me just say this. Through my AI work on my other committees, and Armed Services is one where I'm chairman of the subcommittee on cyber, I learned that AI is useless, truly useless, without accurate massive database. So does the VA own all its own data? Are you including what is created by contractors? And do you own that? Access to all contractors' data that would go into your database, and who is that managed by? Who's managing that for you?
Well, sir, for a complete answer, we will have to get back to you. But I can tell you, speaking as researchers who love nothing more than access to data, I can tell you that because of the work that our corporate data warehouse team has done on both the clinical and research sides, we have access to quite a bit of data.
Okay.
But I can tell you that there are some challenges in getting data back. For instance, in the case where genetic testing is sent to outside laboratories, that data is not specified in the contract always to come back to the VA.
So, I mean, have you looked at your contractors to make sure that they're basically, you need this to do the accurate work you need with AI for it to be effective? Have you started recommending those changes be made so when you have outside contractors, you do own that, or you have rights to those to that database?
I know that in the conversations I've been privy to, which are in the context of oncology, that those are active discussions about how about ensuring that we get data back from those data providers.
Thank you, Mr. Coons. If I could talk to you about it, because it's just a horrible situation, I know, and I thank you for your work you're doing, the mental illness and all the suicide, and all the problems that we're having with our veterans. I was always interested when someone is basically retiring out, coming back from either service, coming back from combat, and they're basically been diagnosed with some challenges. Is that forwarded on to you if they come back to Montana? In Montana, are you made aware of all the medical conditions and records upon discharge that soldier may have?
Sir, I don't work for the Veterans Administration, but I know that that's been something that we've been working with.
I mean, do you know if there's a problem there? Because it seems like to me, they're coming back home in West Virginia. We should have been notified that there were some serious problems we could have intervened and helped them with. And we're not seeing that until it's almost too late.
Sir, I agree with you. I mean, it feels like it's something that's always talked about, and it feels like from the DOD side, if you could lean on those folks and make sure.
Let me ask you this. Do you all, any of you all from the Department of Veterans, VA, know any about this? Are we able to access those records? Is my 4 hospitals in West Virginia going to have access to the medical records coming out and discharge records of a soldier coming out of service?
So, sir, I'm going to have to take that question back, but I want to make sure that I understand. Are you asking whether the VA receives the records from all discharged military?
Well, I would say that
members?
if I'm coming out of the military and I'm discharged, okay, so you check me out and I've had some problems, I've had some conditions,
Yes, sir.
and you all have treated me while I've been in service, while I was fully employed, deployed. Now I'm discharged. And you would ask me, what hospital do I want to go to? And I'd say, I want to go to the Woody Williams
Yep.
VA Center in Huntington, West Virginia. And would they be aware, would you make them aware of all of the conditions and all the prior treatments I've received so they know that I might have some substance abuse problems?
Thank you, sir. We will take that
I
question.
don't, but I want to
on
say, I'm
record,
just
but-
hypothetically, okay? We're just,
Yes, well, we will take that question and get back to you because now I have a sense of
What I'm trying to get
of
to.
what you're asking. Yes.
I
sir.
said, we could,
Oh,
yeah.
well, I know that once somebody is enrolled in the VA, that the VA does have access to DOD records. I'm not certain if prior to the enrollment, those data are available. I'm also aware that there are a number of transition activities that occur upon discharge from the DOD to facilitate enrollment in VA. But again, I'm not certain then whether if somebody doesn't enroll, then does VA have access to those records? And I think furthermore, Mr. Manchin, if I understand your question, then is there some proactive way
I'm
to
just saying,
identify
if we could
people with
intervene,
issues?
and
Yeah.
Mr. Kuntz, you.
Gentlemen,